It goes without saying that coal has a long and troubled history in West Virginia. In 1921, the largest labor uprising in U.S. history, which was also the largest armed uprising since the Civil War, took place at the Battle of Blair Mountain. It was the culmination of years of conflict between coal miners and mine owners. Now, over 100 years later, the battle continues. However, this time it's between miners, the federal government, and an Oak Hill lawyer who has spent his career working for miners with safety and health concerns, leading the charge. WOAY spoke to this lawyer to bring you the story.
These federal programs are here for a reason, because hundreds and thousands of workers have died of silicosis and black lung, and the American Congress decided that was wrong. We're going to try to stop that.
Well, not anymore. On April 1st, the Department of Health and Human Services announced that in their strategy to improve its efficiency and effectiveness to make America healthier, they would be executing a reduction in force. This reduction includes the entire Respiratory Health Division, which includes mine safety and health programs, as well as mine safety research programs. It also includes the NIOSH mobile van that traveled to mining communities to screen for black lung disease.
It's all gone. If you go get screened on your own and send in your x-ray for review by NIOSH, they will not answer you. The program is shut down as far as we are all been told.
However, many see this as a violation of Title 30 of the U.S. Code, Section 843.
Since 1969, the Federal Mine Act has said all miners get free health screenings and they have the right to transfer to non-dusty jobs. The administration has decided they don't care what Congress has mandated. They're shutting these programs down anyway.
This apparent disregard for federal law has prompted Sam Petsonk to file a class action lawsuit on behalf of a miner who developed black lung disease and requested a transfer prior to the cuts at DHHS.
These are programs that save lives. Participation in the job transfer program by miners has increased tenfold in the last 3 or 4 years because miners see that they need to transfer to avoid fatal black lung disease.
It may be surprising to learn that even though black lung has a long history in the state, it is becoming more common, especially in younger miners.
Black lung has increased a lot, especially in Central Appalachia over the last 20 years, because the coal seams that are left around here are very thin. We've mined all the gravy. We've mined all the big coal seams. To get to the thin coal seams, you have to cut a lot of sandstone. And sandstone is made of silica, and silica is extremely toxic to the lungs.
Of course, all these cuts we are seeing at the federal level are to save money.
You might be saving money for the insurance companies, you might, but frankly, you're not saving money for the federal government because let me tell you, the federal government is paying these bills one way or the other. They're paying the bills through covering emergency care at hospitals, through Medicaid, through Medicare. Medicare has paid for more black lung treatment that, over the years than they were ever supposed to pay because coal companies dodged the liability and pawned it off on Medicare.
Coal miners have been fighting for their rights as long as they have been mining coal. Progress made seems now set to be undone. However, that is up to the court system.
If we're going to keep mining coal, we are going to be facing a lot of sandstone and a lot of silicosis. If we want miners to do that work for us, we've got to protect their health. We've got to give them the right to live a healthy life.
In Oak Hill, this is Mike Teeney, Newswatch 4.